get going. I just got to shut this down. Here we go. Okay. All right, let's get going here. Hang on, let me start the webinar officially, and then we are okay. Welcome, everybody. It is great to have you here. Let me go ahead and put up a couple of screens so that I can go ahead and see. And then we want to ask you folks, can you go ahead, tell us who you are, where you're from, what kind of dentist you are? Put that in the chat. I want to make sure that you guys can hear me and you can see me. And I'm joined by Dr. Neil Valens, who's a periodontist, and so we'll get that. But go ahead and put that in the chat. As you're logging in here, put this in the chat. Tell us who you are, where you're from, what kind of dentist you are. I want to make sure that you guys can hear us and you guys can see us and that everything is going pretty good. So let's get that chat going. All right. Thank you very much. Welcome, Rima. Welcome, Ranim from Chicago. GP, a lot of general dentists I'm sure we're going to have. Monica from Denver. Emily from South Carolina. Now they're coming in really fast. So great to have you all. I don't know if I'm going to get to all these names because they're really coming in fast. So it's great to have you here. But we've got Noor from Cleveland, and that's where I'm broadcasting from. Hello, Alan, my good friend. It's great to see you here. We have got Dr. Don from Los Angeles, a general dentist. A lot of general dentists on here. I am sure we're going to see a bunch of others. Nana, great to see you. And she's an AAFE member. Thank you for being an AAFE member, as I know a lot of you are. Angie is a GP from New Jersey, and Ines from Dominican Republic. Christopher from Lubbock, Texas. So go ahead, keep putting them in, and you get an idea. You get an idea of the kind of reach that we have. So let's go ahead and get started here because we've got a lot to do. Jennifer is a pediatric dentist, and that's good to see you here too. We've got Arvind is a perio from Cleveland. Welcome. And we've got lots of you. So we're going to jump in to this. I will just tell you, go ahead and keep putting it in the chat as you're coming in. For this, let's go. This is a really exciting topic. We're going to go ahead and fold it in also with facial aesthetics a little bit. Valeria is an oral surgeon from Ecuador, so welcome to you. We've got an international office audience here too, so it's great to have you here. I'm going to put up my slides, so you'll tell me if you can see my slides here in a second. We're going to go full screen on the slides. Someone tell me in the chat that you can go ahead and see the slides, and that would help us, and then we are ready to go. So you can see us, you can hear us, you can see in the slides. We're going to have a lot of questions for you because I really want to get your input. This is a really exciting topic, as you're going to go ahead and see. So we're going to jump into it, but we're going to do a little bit of an introduction here too, and we're going to, because especially about the economics of dentistry, because literally there is just a report that came out today, and I spent the last little bit trying to get some of this into this program because it's amazing. It's amazing what all of us think of dentistry and where it's really at for that. My name is Dr. Louis Maltzmacher, and I am president of the American Academy of Facial Aesthetics, a clinician like all of you. And there is the AAFE, the American Academy of Facial Aesthetics. There's my email. There's the AAFE's email. I'm going to show you. I'm going to put you to aafedentist.com. That's where I'm going to send you to for whatever tuition specials and everything else that the AAFE has got going. StatDDS.com, they're going to be the supplier of the material that we're going to use for Black Triangles and Gun Builder. And as always, AAFEwebinars.com, because the AAFE gives constant webinars on all kinds of topics here. So it's great to have all of you on. Please follow us at Instagram, Facebook, and YouTube, and TikTok, and all the other social media channels where we post all kinds of things every single day. We are known for live patient training courses in injectables, whether it's in the mouth that you're going to see or it's Botox and fillers, and we collaborate with all the dental associations and the dental boards. We presented to more dental boards over the last nearly 20 years than I think anybody on this. We have full-time faculty. We've trained over 23,000 healthcare professionals and a ton of dentists. The bulk of that would be dentists in injectables. And certainly we're really excited to share this with you too. We have the best faculty in the world. You're seeing all kinds of healthcare professionals, but about 70% of these people are dentists, endodontists, periodontists, general dentists, We have got cosmetic dentists, you name it. We've got the kind of dentist that's in here. Pediatric dentists are in here. It's really incredible what we've got. But they are the finest people in the world. You're going to meet one of them that's on with us, who's a periodontist this evening. And I might as well do an introduction to you, Dr. Neil Valens. Dr. Neil Valens, that's the other screen. Just say hello to everybody, Neil.
Hey, how are you doing? I practice in New York and I've been doing this for quite a while.
Yep, and he's one of our faculty for all the injectable courses, but is certainly one of the leaders in Gum Builder there too. You can find everything that you need at afedentist.com. That's where I'm going to go ahead and show you. I just like to, show the AAFE always offers a webinar tuition special, so I'm going to show you that. We give our courses all over the United States and a few international locations, including just about all of these locations we're in bi-monthly, some of them monthly. So the stars are AAFE training centers. We have nearly every course every month that the AAFE has to offer. So they're all destination, and a lot of you live around them. So wherever you live, we're probably giving a course. There are special tuition packages, which I'll show you, that there are only 20 available tonight to all of you, or until midnight tonight, whatever comes first. Gum Builder and Black Triangle, these are live patient training courses. These are the upcoming courses from February to June. The New York City ones, you will see Dr. Valens. He's one of our finest trainers in Gum Builder here. So, and he also travels around at some of this. And here are the different packages. Again, there are 20 of these packages available, whatever you guys choose for that. The all-in clinical and aesthetic package is, again, designed for dentists who want to get into Botox and fillers and Gum Builder, Black Triangles, and TMJ, oral facial pain. We've got a lot of different offerings. That's a 3 live patient certification course package right here. 52% off. This is probably the best deal that the AAFE ever gives. And it also comes with all these bonuses that come to a total package savings of about, I think, $13,000 for $39.97 for that. And you can pick the Live Patient Gum Builder as one of the courses there as well. If you only want the live Gum Builder training, live patient Gum Builder training, then the middle column is for you. And again, there are a lot of locations to choose from. Make sure when you check out, you use that Gum 200 at checkout to save an extra $200 to get the price down to $15.97. If you want an online Gum Builder certification course, at least to get started, so you can see it, they've discounted it to $9.97. You can then apply that in the future to a live patient Gum Builder course for that. So that's what you've got. You'll find all of it at afedentist.com. All these offers end at midnight tonight. There are only 20 available, and you can go to that QR code if you wish. And take it there. These are all the bonuses that come with that $39.97 package. Again, you can choose any 3 live patient certification courses. Most dentists are going to choose our level 1 Botox. If you're just getting started, level 1 Botox, level 1 filler, and level 1 TMJ or Gum Builder, depending on what you like. They do have weekends where they combine all 4 of those courses, and they will definitely go ahead and give you a break on that. You'll also get you will get the bonus number 1 is the Med Spa Aesthetic Practice Business on Demand training, a worth that they sell for $19.97. That's going to be included. You get almost $10,000 worth of bonuses that come with this. You get up to $1,125 of injectables to be used at the course, 1 team member free, exclusive member forums and post-course support, AAFE membership, office locator, AAFE logo, all kinds of things, all the office forms, everything you need, no matter the course that you take. Level 1, if you already took a level 1 and you're ready for level 2 or level 3, you can use this package. But if you're entry level for Botox and fillers, then the level 1 courses are what you're going to do. Just lock in the package. Don't worry about location. You'll get the location that you want. You'll get the courses that you want. The AAFE will go ahead and contact you tomorrow. This is the best price that I have seen in the last few months. So I will tell you that. And the AAFE sets all of this. So if you want it, grab it. Lock it in now. You can take these courses later in the year. You can take them next year. It really doesn't matter. I don't know why you would want to. We'll talk a little bit about the economics of this also. But we're the number 1 training injectors that are used to make $50,000 to $100,000 a month in injectables, in addition to your dental practice for that. And your family and existing patients are already paying someone else for Botox, and it's the best investment that will pay you back. In your first 5 to 6 patients, you literally will make back your tuition, and then you are pretty much done. And not only that, we will work with you to start treating paying patients. No matter if you're taking gum builder, if you're taking Botox fillers, TMJ, doesn't matter. You're going to literally, we're going to push you to start treating your paying patients in 14 days following the training. There's nobody else that's got the resources to go ahead and do that for you. And as a dentist, I'm a dentist too. So as a dentist, stop your paralysis by analysis. We've been, some of you have been thinking about getting Botox training for years. And you've got people like Dr. Valens that have a huge practice in Botox because he started years ago, and you can do the same thing for that. So it's time to start getting off the paralysis and stop analyzing this. We know that this works from the thousands of AAFE dental members that we have for this. But here are some of the scary things I just want to share with you, and I just want to kind of set the tone for the black triangles and gum builder and what it means to patients, because that's reflective of all of this. General practice, this is from the ADA Health Policy Institute. This is from last month's report. This month's report just came out. I'll just show you one slide from this month's report. General practitioner net income since 2010, adjusted for inflation. 2010, a general dentist made $267,000 a year. In 2024, they made $207,000 a year. That's a $60,000 drop over the years. That is a little bit scary. And I think all of you feel that too. This just came out. Again, I'm not going to go through the whole report. I just want to use these 2 slides. Look at this. This is Q4 2025. We're only a few weeks into this new year here, and 33% of dentists say they are not busy enough, could have treated more patients. Another 36%, they treat their patients and they're not overworked. And then you've got about 30% that are too busy or treat all the patients. Now, you don't know if these are Medicare practices. You don't know what any of these are. And all of our live patient training are CE courses. I mean, that's for sure. For that. So that is pretty scary. So I want to go ahead and do this. I want to poll all of you, and let me just find the poll button here. And let me poll you with this exact question that is. So I'm going to launch this poll and you can start putting it in. Are you busy enough? Right now, are you busy enough? Are you too busy to treat all patients requesting care? Are you treating all patients requesting care but overworked? Are you treating all patients requesting care not overworked? And are you not busy enough and could be treating more patients? So I was a little surprised. I thought it would be more than 33%. I think you are more reflective than whoever they are, because I talk to dentists all the time, really all the time. For that, again, it really depends on your. I can see treating all patients requesting care but overworked. That could be a Medicaid practice. It could be any kind of practice, really. But I would bet some of those are Medicaid practices where just patients are climbing in all over the place. All right, here are the results. Right here. You have got 41%. I'll just share that so you can see it. 41% are not busy enough, could be treating more patients. 29% treating all patients requesting care but not overworked, which means you still have capacity. And then again, you've got some too busy to treat, and you've got some treating all patients requesting care but overworked for all of that. Or you want to work smarter, or you want to make more money with more elective procedures. Gum builder, you're going to see, is not an elective procedure. But thank you for taking part of that, and that is all good to know here. All right, let me ask you this. If you ran a business, and this you can put in the chat, 1, 2, 3, or 4, and it can be multiple that. If you ran a service business, which you do, which services would you offer? Would you go ahead? What will make you the most in production? A service that everyone wants and needs and is affordable, service that very few people want and is affordable, a service that everyone wants and is expensive, but few can afford, a service that very few people want and is expensive that few can afford. So what do you think? You can go ahead and put it. I've got this on multiple platforms here. So go ahead and put it in the chat on the webinar platform. Go ahead and and then just put it in whatever platform that you're on for that. So we see a lot of ones that are coming in. A service that everyone wants and needs and is affordable, that will make you the most production. Service that everyone wants and is expensive but few can afford, that certainly will it make you the most production? Certainly number one. Number two and number four, no one's choosing. So it's going to be between one and three, and it can be a combination of one and three, right? For all of that. And I would probably agree with all of that. So let's keep that in mind. Now let me ask you a different question. And again, put it in the chat on the webinar platform and the other platforms, put it in the comments, and we'll just give an overview. Which services are the most popular with your patients right now? Or which services do you think are most popular with any patients? There, go ahead and put it in. So whitening certainly is a popular one for that. Implants are popular. Invisalign is popular for sure. Implants, it's funny. Not too many people are saying veneers for that. Endo, I don't know how popular endo is. Maybe six perio. I mean, it really depends on your practice, right? For that. So it's kind of like all over the board. And then Gaurav says, 1 through 6. So that's true too. Now let me go ahead and ask you this. You saw this slide. Now let me ask you which services you think are the most popular with your patients. And you see a nice before and after here too. Now answer the question. Which one do you think is the most popular worldwide with patients? Go ahead and put it in here. I mean, this is not even a question. Okay, this is implants over Botox, not even a question. I'll even ask you a better question here. Which of these services applies to nearly all of your adult patients? All of your adult patients. Whitening, yeah, if they have teeth, that could be a close one. Veneers, no. Implants, no. If they don't need an implant, they don't need an implant. Invisalign, which ones apply to all of your patients? Endo, no. Black triangles, gum builder, if they don't have them, they don't need them. Botox applies to nearly every single one of your adult patients. And what we find today is from 20 years old up to 80 years old for that. But black triangles and gum builder is huge, and that's really what we're going to focus on. But I'm just going to make one more point, and then we're really going to go ahead and get clinical here for that. But I just want to set the economic part of this, which is really important. It's really incredible. And again, over the last 45, nearly, it's more closer to 50 years that I've been teaching and I've been working in dentistry, and that's working on patients and also teaching. I have taught implants, and I have taught veneers, and I've taught whitening, and I've taught almost every one of those. I've taught endo, I've taught perio, I've taught just about everything. And many of you may have taken courses, if you're a little bit older here for that. What's incredible is how many dentists, again, I'm not saying you shouldn't get trained. You should get trained in implants and Invisalign and all of these and veneers and everything else. But they will spend tens of thousands of dollars to go through an implant curriculum, which you should. And really, how many big cases do you do a year with that? You do 5. If you're really successful, you'll do 10, right? Some of you are super successful. You're doing 2 big implant cases a month, right? The volume typically is very low for most because patients, it's hard for them to afford a $30, $40, $50,000 case, plus all the time that it takes you, right, to plan that case, to place that case, right? And then it's hours and hours of your time to do that. Or you can go ahead and spend less than $5,000, and with the AAFE tuition special that you're getting tonight, less than $4,000, and you don't have to buy any special equipment. There's no lab fees. There's a short share time. Your career ROI is much higher because it applies to all of your Botox fillers, TMJ oral facial pain. Even that applies to 1 out of every 6 patients. That's not true of implants. It's not true of Invisalign. It's not true of anything else that walks into your office. I mean, it's huge. And now we're going to get to gum recession. That's going to be even higher. I'm just always amazed at how dentists will spend a ton of money, and rightfully so. It's good to have a great implant practice, but you're still only doing a few cases a year, especially big cases, as opposed to Botox is every day, and that is really what drives your patients so that you can do the other stuff for that and really help out. You need something really bread and butter that's not insurance based, and that is going to be Botox fillers, TMJ training, and also gum builder, which black triangles, which we're going to get to now, that actually is insurance based. And we're going to show you that. There are dental codes, dental insurance codes, and people have been getting paid for it for sure. Dentists can do fillers and Botox in every single state. We teach in every single state, the AAFE, and we work with every single dental board. Some of them you have to document properly in all of them. We'll get to that later on, but let's get to gum builder right now and black triangles here. I want to make just one big point. What we have got to change our thinking, because most dentists and many periodontists and all kinds of dentists think that gingival recession is normal, and it's not. It's a disease process. It doesn't automatically happen in the front six teeth. Here, there's some recession in the back teeth there a little bit, but here it's more about black triangles. But gingival recession is a disease process. It's actually the most undertreated disease process that we have in dentistry, because most dentists think that it's normal because it's so common, but it's not. And patients want it fixed. But the question is, what do they want? Well, and you can't separate gingival recession and black triangles. Yeah, a lot of times they certainly go together. In the case I just showed, it wasn't going together. They lose volume between the teeth. So we're going to show you how to fix that. But gingival recession, the number one choice is doing nothing. You've got connective tissue grafts, coronally advanced flaps, pinhole technique. 92% of patients refuse surgery. And, when they get to Dr. Valen's office, who's a periodontist, and some of you who are periodontists on here, more of his patients accept surgery because they've been filtered out already through my office. That's a general dental office. So the ones that seriously consider it are going to see the periodontist. But most of them, every general dentist, you can agree or disagree in the chat with me, but I've been general dentist for a long time. They absolutely, most patients refuse surgery for that. But I don't think most dentists take gingival recession seriously enough, but it is a disease process. But now we've got a non-surgical treatment where at least we can do something. But black triangles, why do they happen? Or how can we fix them? There are a lot of reasons that black triangles happen. They could be natural. It is essentially a loss of volume between the teeth. What can we do? We can do papillar reconstruction. We can do composite bonding. We can do orthodontics. Sometimes that will help. We can do soft tissue tunneling grafts. We can do nothing, but patients like to have, and they don't like the black holes between their teeth. We can use dermal fillers, or we can use a Kaha filler. That's what we're going to concentrate on, and the whole gum builder technique to go ahead and fill up that volume. So that is what we are going to go ahead and do. Neil, you're a periodontist. Have you done papillar reconstructions, and are they successful for black triangles, or how hard are they?
Black triangles are very easy to do. They take about 2 minutes.
No, I'm talking about surgically. Can you surgically do it? You're a surgical periodontist.
No, you really can't do it. Any success, like the black triangles with the radius, is much better.
Yeah. All right. No, we're going to get to that. But let me just show you this. Composite bonding is an option for these black triangles. And how many of you that are on here have tried composite bonding for black triangles? I'll just show you this beautiful before and after, and it's a great case. The problem is, and not the problem, the challenge is, if you've gone ahead and done these cases, how long did it take you? I've done these cases over the years. These are hard cases. I know they've got, different things that you can, different matrices that you can put in, and kind of, they call it injected molding and that kind of stuff. But to get this kind of result, this is hard, okay? And again, put it in the chat if you've done this, and tell me if it's easy. Maybe I'm missing something. For me, this was always hard, and it takes a long time to really polish these down, make sure there are no overhangs or anything else like that. Teeth will look a little stubby, but at least it will fill up that area. So that is an option for that, but it's not an option for this, right? It's not an option for a lot of different things where you're missing, where you're really missing that. So let's go ahead and take a look. The difference between surgical versus non-surgical in going ahead and getting and treating some gingival recession and trying to get some coverage for that. Non-surgical, the goal of non-surgical is to stabilize the tissue, stop further recession, and get a slow creep of the tissue going up to cover that. Will you get full coverage? Maybe, maybe not. But at least you've done something and some treatment for the 92% of patients that are not going to go ahead and have surgery. And what's interesting is from our statistics, 88% of patients accept a non-surgical treatment for gingival recession and black triangles. Surgical, I'm not knocking surgical. I've done them. Dr. Valens has done a ton of surgical cases. He does them to this day. The downtime and you get significant discomfort. There's significant cost and time. Results are variable. Nothing is guaranteed. This is a beautiful surgical case that you see. You definitely may need multiple surgeries. I mean, this is just the truth. It's not a knock on anything. You've got to give the patients all the options, non-surgical or surgical. And again, only 8% of patients accept treatment. We have polled thousands and thousands of dentists on this topic here, and it always comes out to 92% of patients refuse gingival surgery. They will not get the surgery for a lot of things. All you have to do is stop thinking like a dentist and start thinking like a patient. What would you do if you were told you would need surgery? What would you do? You would Google it, and you would go to Real Self, or you would go to all these consumer websites and, talk about gingival graft surgery. And, even the people who have had it are not that favorable. We love this result. We think this is beautiful, but it came certainly at a cost for this. By the way, a lot of patients, this is what they hate the most. The palatal graft that then epithelializes over, or you took a graft from somewhere else. It just hurts. It just feels like a bad pizza burn for a few weeks. Their patients don't love it. But these are beautiful cases. This is the gold standard for that. That's not what you're going to get with non-surgical. It's going to be a slower process. And I always kind of use the analogy, God forbid if somebody has cancer, certainly the surgical option is great. Go in, cut it out. No matter the cancer, go in and cut it out. But with that, there definitely comes some risks, right? I mean, certainly with cancer, it's going to be even more serious risks of nerve damage, depending on what part of the body that you're working on and all kinds of things, as opposed to what are the other options? The other options can be radiation. The other options can be gamma knife. There can be all kinds of different surgical, non-surgical options that slowly reduce that size of the tumor. Here, the same analogy. Surgical is great, and you can get full coverage with this, but again, it's not promised for that. Or would you rather have a slow regeneration of tissue? Because that's what we're talking about. Slow regeneration of collagen tissue that will eventually cover most of this and give you really healthy tissue, because you can see what is going on here. And this, patient just didn't want to do surgery for year after year after year. This is what gum builder starts to look like, and this is what the closing of black triangle starts to look like, all at the same time. It's a regeneration of tissue for that. So that is the basis of what we're going to do. Now we're just going to talk about, we're going to get to videos right away and show you. It's easier to show you than to talk about it, but the need is huge. You have 58% of patients from 18 to 65. Okay, 58% of patients from 18 to 65 have some form of gingival recession. It is not true that it's only an old person's disease. It is true that after 65, it's 80% of geriatrics like me that have some kind of gingival recession for that. So the number does go up, but you'll find it in young people. You'll find it in a lot of your patients. And all you got to do is just open your eyes and stop telling patients, let's watch it. Now we have a treatment for it. So the need is huge. Collagen biostimulation is what we're talking about, and real tissue regeneration. Bonus is it eliminates dentin hypersensitivity literally within days because of the calcium release that is in the material that we're going to use. And the treatment takes only a few minutes once you're well trained and backed by science and standard results. We'll cover that in just a minute. very high profitability, which we're going to talk about. Your first 2 or 3 patient treatments pays off your training investment for Gum Builder. I mean, that's pretty much it. We saw it before. I think the regular cost of the live patient course is $17.97, and I think there was a $200 off for that. That's 2 or 3 patients. That pays for that, and then you've got the skill for the rest of your life for this. So this is the #1 solution for mild to moderate recession cases. It's #1 alternative to gum graft surgery for the serious cases, but you can use it for serious cases. We are talking about cases, not periodontal disease. We're not talking about periodontitis. We're talking about it's a healthy mouth, but you're left with gum recession that just keeps going away. Now, this is been scientifically proven a regenerative periodontal therapy. It's been FDA cleared since 2003. And that the filler that we are going to use for that. So this has been around for a long time. Nobody really knew how to apply it. We've been working on this for a few years. And really developed a technique on it where we're really getting the results that we've always wanted. But it stimulates gum regeneration through collagen biostimulation. It takes a few minutes. I'll show you some videos for this. Little or no post-op complications of pain, and reduces tooth sensitivity, which is a great bonus. What are we doing here with Gum Builder and Black Triangles? We are going and placing it in the connective tissue. That's what we're doing. And again, we're just going to show you. I'm not going to go through all the science right here because we're just giving you kind of like a taste of this. But this is actually going to be a real attachment is going to creep up. We're not in Black Triangles that I'm going to show you first, where you got hold between the teeth because the gingiva disappeared. That is about volume. But when it comes to Gum Builder later on and stabilizing and reversing gingival recession, that's going to be about real collagen regeneration, and the creeping up of the entire, even the attachment is going to move up that tooth, but it's a slower process for that. So that's pretty much what it's going to be. We are going to use a product called Radiesse. That is the calcium hydroxylapatite CAHA filler is what it is. You don't have to be trained in filler before. It's got nothing to do with facial fillers. I mean, this is a facial filler too, but the technique of just Gum Builder, even if you've never been trained in Botox and fillers, totally separate skill, as you're going to go ahead and see. You can all master it for that. What is so special about calcium hydroxylapatite? It is a great collagen biostimulator, and that's what we are going to do. It regenerates tissue. Collagen is the building block for tissue, and it regenerates tissue. It also has some lidocaine in there. It also has CMC gel, which is carboxymethylcellulose gel, which is an antibacterial, which really helps in healing as well. For this, you can absolutely use it to eliminate hypersensitivity, because the calcium, if you know anything about hypersensitivity, I don't want to go into it too deeply because I lectured on it for years. The best thing to do is get calcium into those dental tubules, and that will eliminate hypersensitivity. The problem is that how do you get calcium into it? You need calcium ions to migrate into those dental tubules, and many of these gingival recession cases, as all of you know, one of their biggest complaints is hypersensitivity. When you do a Gum Builder case, 2 days later, their hypersensitivity is gone. It's amazing. Why? Because the calcium ions have leached into dental tubules. I'll leave that for now. When you get trained in Gum Builder, we go through that science much more deeply. And as part of what we do, we actually push that calcium in these microspheres into those dental tubules as part of the process there as well. But this is pretty much what it is. And again, this has been, well, I'll show you the FDA clearance in a minute. This is exactly how it works. You've got loss of collagen. That's gingival recession, is loss of collagen, and everything is pulled down on the lower, everything is pulled up on the upper, and you are going to put this gel matrix into the tissue. That's going to create a scaffold that stimulates fibroblasts. Those are going to produce, it's the body reproducing its own collagen and elastin, and that is going to firm up the tissue, stabilize it, and then it's slowly going up. We will show you what we're talking about, and we'll show you before and afters and there. It's a good time to go ahead and also mention that right now the AAFE is in a 500-patient study on Gum Builder. We're about halfway through with this, and we've got the data sets on, almost a little over 200 patients there. We've got about 370 patients that are in that are in treatment right now for all of this. And the initial study of the data is showing incredible results. I mean, we're talking about an average of 4 to 6 millimeter of growth. Really just depends on the case, but that's what we're taking a look at. So we'll see how it all comes out once we get all 500 patients in. But that is looking fantastic. This has been FDA cleared. You can see it yourself right there since March 4th, 2003, revised June 9th, 2003. And this is Bioform. It's now called Radies, calcium hydroxylapatite implant for periodontal defects, ridge augmentation, a whole list of things. But that's exactly what we are talking about for that. How do we get it into the tissue? We are going to use a ComfortTox syringe specially designed. Somebody, Flint, mentioned clogging. This is a specially designed syringe, a 29 gauge needle in the ComfortTox brand. This was designed exclusively for gum builder, but we also use it for some of the facial fillers in very tight spaces. For that, but this 29 gauge makes all the difference in the world, and it's eliminated clogging on this. Initially with 30 gauges, we're trying different things. You'd get some clogging, not anymore. And this is what a ComfortTox needle looks like. It is a multi-bevel, super sharp technology, as opposed to a lot of the other ones that come out of the package that are just really, really ragged for all that. You can get that at statdds.com for the gum builder technique. But I first want to show you I first want to go ahead and show you a black triangle case for that. So that's the needle I was using. What was lacking on my technique? We'll talk about it. That's a great question, Flynn, for that. Let's go ahead and show you the technique, just black triangle, and then I'm going to show you a second patient that's going to be gum builder and black triangle. So here we go. I'm going to shut off. Neil, do you know how to shut off your video? If you shut off your video, I can stop your video, I think.
You can stop it, yeah.
No, I'll stop yours and mine. All right. I stopped the videos just because you'll have a better experience for the video. So here we go. Now let's go ahead and treat Shani for some black triangles. The first black triangle we're going to treat is between this cuspid and... Yep, sorry about that. Hang on. Now let's go ahead and treat Shani for some black triangles. The first black triangle we're going to treat is between this cuspid and the lateral incisor. And this is, you can see, she's had deficient volume between those two teeth. She's got a couple others we're going to treat, including the one right between the central incisors. But take a look at the other cuspid, between that cuspid and lateral incisor. You can see there how that is naturally filled up. So she's got at least two black triangles. We're going to start with those. We're going to treat this a couple of different ways. Black triangle technique you're going to see is obviously much different than gum builder. We're going to use two different materials. First one we are going to use is going to be the Kaha material that we use for black triangle, but now we're going to use it for volume. Let's look at the technique. We are now in the papilla, and that is going to go ahead and we're going to go back and forth, back and forth, back and forth a few times because we are looking to create some space in the papilla so that we can place the Kaha material, the calcium hydroxylapatite material, for volume now. That's what's different than the gum builder technique. Gum builder technique, we want Kaha microspheres in the tissue to get collagen biostimulation. Now we want volume. So we are going to now add some volume. We're going to create a little bit more space. And this is also developing a feel. We're using the tip of the needle as a little scalpel internally, staying in the papilla here. And it's going to bleed, and especially if it's going to bleed, because we just did the gum builder technique on her. So this tissue is really kind of beat up a little bit. Now we're placing the Kaha material with volume, and you're going to see we're going to get quite a bit in there for volume. If some of it comes out, that tells us when we have added enough, and that was good volume just in that one injection because we had already created some space. And that is the whole point of what we're going to do. And it's fine that it bleeds. And again, especially for the Kaha material, because as it mixes, the blood mixes with the Kaha material, that stimulates the collagen. But here we're going for
volume. So we've got some good volume in there that we are shaping with a cotton swab. And then we are going to go ahead and put our finger into her mouth and support the lingual part of this. So now as we go ahead and place more volumizing Kaha material, same material, just using it for its volumizing abilities. Now we are going to go ahead, and my finger is against the lingual, and it is going to trap it so that it is not going to come out the lingual or push the tissue out, volumizing it towards the lingual. I wanted to volumize it up, and then we are going to go ahead and shape it again. Keep adding as we need to try to get as much as we can. As soon as it starts coming back out, or I feel like I just can't get any more in there, then that is when we are going to stop for now. And this may take 2 or 3 appointments. It just depends. Now, she's coming back anyway because we treated her for the gum builder technique. So that is going to be just perfect here. And then we're just going to kind of feel our way around, see how much volume we got. We did get some significant volume there. That is looking pretty good. Now we're going to go ahead to between the central incisors. But here we're going to use a different material. Here we're using a hyaluronic acid jelly material, and that is a dermal filler here. And this is going to be a medium or medium to heavy dermal filler. Same technique. I'm creating space. You see, I'm going back and forth in that papilla. What I'm doing is creating some space using the tip of the needle as a little scalpel, and then we are going to go ahead and add some volume with the hyaluronic acid, medium to medium heavy the dermal filler, and that's what we're going to do. And you can see that is starting to now volumize and starting to creep up. Here it's a little bit easier to see some of the material is going to be coming back out at us, and that's telling you that's all this tissue can take for right now. Once it sits in there for 2 to 3 weeks and the tissue goes ahead and expands, then I can come back a second time and do the same thing, and then I'll have more expanded tissue and it can accept more of the material here. You see my finger is in the back, and that is, again, supporting the lingual so that we are not going to get projection or the volume going towards the lingual. It doesn't do me any good there. I want it to go up. It may not completely go ahead and close the space in 1 appointment, maybe not in 2 appointments, but it will definitely be closing the space a lot more. And it has already, if you can go ahead and start to see this. Again, now here I'm adding some more of the filler in there, and it's coming out. And when you see it come out, that's all it can really accept for this appointment. Be patient and give it some time. This may take 2 or 3 appointments to really go ahead and fill up this black triangle. And again, we never promise the patient that it's going to be filled completely. We are going to go ahead and fill it. It'll definitely be better than we had it before. There you can see the immediate after. That looks really good. So we'll see what this looks like in a couple of weeks.
All right, so let's see what this looks like here. And I'm going to get my video back on. Okay, I'll get you back on in just a minute there, Neil, once I figure that out. Okay, so you know what? Let me get this back on for Neil. Wait, where are you, Neil? I gotta, okay. It says ask to start video, so you may have to do something on your side there, Neil. There you go. Okay, welcome back. Okay, so here you have her before. Now, again, this is Black Triangles is about, now she also had Gum Builder. I'm going to show you a combination case coming up next, but Black Triangles is about volume. Lack of volume, you're going to add volume and really kind of pick up the black triangle here. That's what we are going to accomplish. So that's about volume. What you're going to see, and the reason I like to show this first is because the Gum Builder is not about volume. It is going to be about regeneration of tissue, but you're going to get regeneration of tissue here too over time, and that's why we like to use this Radiesse or Kaha material, because you know, it regenerates tissue in that papilla area, and it tends to last a really long time. Patients really, really like this. So let me take some. Let me just show you a quick before and after. Here's a super easy case. We usually charge about $350, $400 per black triangle, especially when it's isolated just like this. Before and after, you can see the patients going through Invisalign. And again, with ortho cases, with implant cases, with crown and bridge cases, with just a heavy restorative case in the anterior, we see those papillas just get decimated, and we see that all the time. So there's a nice before and after. Quick, easy case, $350, takes about 5 minutes for this. What do you say to black triangles, or tell them some of your tips and tricks, Neil?
Uh, I tell them it's going to take 1 or 2 visits. The important thing is making space for the material. So I punctuate the papilla, and I'll add a little bit at a time, very slowly, so it doesn't clog. And it's miraculous how it fills up. It's not difficult. Once you get a few of them under your belt, it's miraculous, really.
Right. And how long do you find the material? I'll answer some of the questions that are in there right now. How
I
long
mean,
do you find the material lasts in there?
I've had material last for up to a year in
Yeah.
there before it begins to react. They're going to floss, and they're going to start again. It's going to start going back down. They have habits, but in about a year, like they do for recall, I might add a little bit more. It never really reverts back to what it was in the beginning, and they definitely see an improvement. And it's really 90% of the patients want to do this. It's already sold for you. When you take the course on a Friday, Monday morning, the patients are there for you, and you're all ready to roll. It takes nothing.
Right. Have you ever had any papilla necrosis using this?
No necrosis, no postoperative pain, no postoperative bleeding, no postoperative symptoms.
Right, and somebody asked before about vascular occlusion. There's no vascular in these tissues to have an occlusion. That is it. And and Flynn, thank you for talking about that. Talk about clogging, because Neil said it right. You've got to inject this a little slower. If you inject this too fast, number one, that you can get clogging even with those bigger needles as Flint is going out. Because if you push too hard, imagine you've got all these little microspheres. You push too hard and everything's trying to rush out at one time, then many times that can clog. But again, you'll get less with that. And also, if you touch the bone a lot and you're pushing at the same time, that's when you can really get some clogging there too. So it's a very just fine, small learning curve. Once you get it, though, you get it. The name of the filler is called Radiesse. That is the calcium hydroxylapatite filler for that. We charge anywhere between $250 to $350 a site for something as big as this. We would charge $350 per appointment, not per site, not per appointment. If we're doing multiple sites, we'll give them a deal. I mean, we'll definitely give them a deal over time. I mean, that's for sure for that. Did I lose my video here somewhere? Let me just see if I'm. I think I'm still on. You guys tell me if you can see my video. I can't see.
Yeah, we can see it.
Okay. That's it. After 1 year, you need to redo it, and it lasts for another year or more. And sometimes it lasts more than a year for that. Can patients brush and floss right away?
I tell them no. I tell them to wait about 2 or 3 days before they get to flossing.
Yeah, but brush they can do, just very light.
Brush they can do flossing. I don't want to push them.
Let's be honest, Neil. They're not flossing anyway. So.
Yeah. I tell my patients you only have to floss the teeth you want to keep. So it's
right. That's right. That's right. All right. The second appointment many times will be included in the initial cost. It really just depends, and you'll see over time. You will see over time with this. The tissue will tell you, and again, that was one of the points of the video. The tissue will tell you when it's had enough filler, because you just can't get any more in. Like it starts coming back out the injection hole, and that's when then you may want to wait a couple of weeks and wait for the tissue. Now that you volumize the tissue, after a couple of weeks, it's kind of like stretched out. Then you can go in for more, right? And that's pretty much what we see. And what's your time frame between appointments if you need 2 appointments, Neil?
I wait 2 weeks between.
Yeah, at least 2 weeks.
2 weeks, yeah.
2 to 3 weeks is pretty much going to be that. We'll talk about coding a little bit later on. I give them you can give them some infiltration for anesthetic. Let's move on because I want to show you a full gum builder and black triangle case there too. But you can keep asking questions for that. All right, those of you who keep asking questions about the training on the different platforms that are here, here it is again. Go to aafedentist.com. These are good till midnight tonight. That's the big package. And again, you can choose a live patient gum builder as one of your 3-course packages. If you're just getting started, level 1 Botox, level 1 fillers, you can choose gum builder. You can choose level 1 TMJ oral facial pain trigger point courses, all things that Neil teaches and all of our faculty teach. For that, and only here you're going to get all these bonuses in one place. If you only want the live patient gum builder certification training, that's in the middle there. And again, I'll show it later too. We give them all over the country. Here we give them a lot in New York. So if you're in the tri-state area, you'll go to New York and you will see Dr. Valens. And then if you only want the online just to get started, then you can always apply that tuition later to a live patient training of gum builder too, if you just want to get started. But this is a really exciting treatment for that. So aafedentist.com, go there. Again, I'll answer more training questions later on. Here are all the bonuses though for that $39.97 package of literally, it's a 2 to 3 patients of Botox and fillers pays off this training for that. And within 14 days, okay, or 14 days are on, we're going to get you to start treating paying patients for this. This is the best investment you're going to make that literally is going to start paying you back. And you'll be doing 90% of all the Botox and filler treatments that are out there. We have advanced courses, there's a whole curriculum for that where you start to do comprehensive cases, just like anything else, just like implants, just like Invisalign and that kind of thing. But total, if you go through our level 1, level 2, level 3, you're talking about, a $10,000 investment, and you're going to be, that really multiplies. But with this package right now, the 3-course live patient certification training, you get all these bonuses, a total package value over $13,000 for that, including this aesthetic practice business on-demand training worth $19.97. You got to know the business side of it. This will really help you also in your dental practice. We talk about consultations. We talk about how to set this up, employees and finding employees and marketing. And marketing, a lot of this course has been updated because we're in an AI world now. So that everything has really changed. It includes injectables at courses, 1 team member per course, member forums that you can see all the different things that are out there. All the office forms. You don't have to worry about any of that. No matter what course you take with the AAFE, we've got your informed consents, we've got your pre and post-op instructions, we have got more forms than you're probably ever going to need, but we want to be very comprehensive to make sure it is. It is considered CE in California, you bet. Absolutely, it is. Every state. We are AGD. What is it? ADA PACE, AGD. No, ADA CERP, AGD PACE. We've got both of them, which is pretty unusual there too. All right, let's move on. I want to show you a gum builder, and you'll see how the techniques are different of gum builder and black triangles and how that really is different. And congratulations to about 10 or 12 of you who have already grabbed packages. So that $39.97 seems to be really popular. So if you want it, there are only 20 packages available, or until midnight tonight, whatever comes first. This doctor started doing gum builder, and he's a big laser gum treatment Lanap guy in New York City here. And his name is Dr. Eris Cohn. You can see that. And he started doing gum builder. He started posting about gum builder, and he called the AAFEs. I remember he spoke to somebody about this. He says, "What is going on with this gum builder for that?" And we said, "What do you mean?" He says, "Every time I post about it on my Instagram," and this just shows you how popular this is with patients, okay, when you get into this. Look at his Instagram right here. Okay, he's got one that's 13,000. I'll show you some of the other ones. But every single gum builder, this one was 60. This is 320,000 views that he got. Take a look at the next one. His normal is 6,000 views, 8,000, which is not bad. 3,200 views, right? 4,300 views, 1086. Look, 275, 90,000 views. He says, every time I post about gum builder, it goes crazy. Say, what is going on with that? Well, that's what patients want. It is new, it's exciting. They don't like their gingival recession. We tell them don't worry about it, but they worry about it because it's their teeth and they don't want surgery. This is a great alternative, and this is really, really talking to your patients. That's for sure here. All right, we're going to go to another video here, but I just wanted to show you. And again, it's about expectations and your expectations. We're not going to get right out of the gate full root coverage. We may never get full root coverage, but what we are going to get is, take a look at this at the beginning. This is after gum builder. This is about a month and a half in. Look at this creep of tissue. First of all, just your attached gingival band is much thicker compared to this little bitty over here for that. And this is starting to creep up. Give this time, give this 5 months, 6 months, and you will get half coverage. And maybe that's all you get. Maybe you get a little bit more. So this is a whole different thing. It's not the gold standard of surgery where you're going to get it, and if it takes, then you're going to get full coverage. But what it is, it's regeneration of tissue, and that takes time. So again, it's just different than anything else when you're doing it. Let me show you now the gum builder gingival recession treatment, and then on the same patient, we're going to go back and we are going to treat her. We're going to go ahead and treat her. Go ahead and treat her black triangles here. Let me just see if I can shut Neil's video off again here. Neil, you may have to shut off your video here to help them out. All right.
It's
see if
off.
you can shut off your. Can you shut off your video? I don't think I lost. Oh, here we go. I think I. Well, see what you can do if you can shut off your video here.
Okay.
I'm not sure. Well, we're gonna go. We're gonna go anyway, and we'll just see.
Okay.
All right. Here we go. But at least mute yourself if you can. That would be helpful.
There is a very common patient that walks into your office every single day. Black triangles and lots of gingival recession and lots of hypersensitivity because of those exposed root surfaces. You see this all the time. Now we have something where we can really do something. Here's more of a frontal view of that same patient. And you can see this is from mild to moderate to some of these are severe. She does not want surgery. So let's go ahead and show you gum builder and black triangle treatment together. And let's go ahead and show you. Let's get with this right now. This is actually her second treatment, and this is after we've anesthetized the patient. So you will see this is much healthier gingiva than we started with at the first appointment. So I want to show you Monica's second appointment here, and you can really have a good idea. Compared to the video, to the photos that you just saw of her, this is much better quality attached gingiva, and also it started to creep up a little bit. And you'll certainly see this in the before and afters as we go ahead and show you. So what are we doing? We're putting some calcium hydroxylapatite filler into the split thickness of the tissue here in the attached gingiva for collagen biostimulation. That's what we're doing to get even more. And again, because we're treating this again at the second visit, we want even more collagen biostimulation. So it's going to continue on from the first visit, but now we're doing this on the second visit so that we get some substantivity of that collagen biostimulation that will now last for a few months. Get more attached gingiva, it'll start to creep up even more than it's done in a short 1 month treatment from its first treatment here. So you can see, now this is going to bleed. I mean, this is always a fairly messy procedure. I would say it's not the prettiest procedure. But this gingiva is actually much healthier than what we did here. Now, these are the areas that we are going to go ahead and also treat for black triangle. We'll show you that. That's a separate treatment here. All we're doing here is we are using the tip of the needle to go right underneath the gingiva, into the attached gingiva, not down to the bone, and we are delivering some seeds. We're not volumizing. We are delivering some seeds of this calcium hydroxylapatite CAHA material into the tissue here. That's going to do a couple of things, and that is going to give us collagen biostimulation, but also it's going to release calcium on a constant basis, calcium ions through the tissue to those exposed root surfaces. By the way, because this is her second visit, her hypersensitivity was gone after a few days of her first visit, and that's really the amazing thing. Some of these were sensitive. Some of these teeth were not as sensitive. You can most certainly kind of guess which ones were and which ones were not here, as you see here. Now, if you put too much pressure, you will get clogging of that tip, because these are little tiny microspheres, but we're using a 30 gauge needle. This happens to be a little bit of a longer needle. Doesn't make a difference if you use a longer needle or a short needle. Why am I using a longer needle in this case? Because that's what I found on the shelf, and I was ready to go with the procedure, so we backfilled some of this with the calcium hydroxylapatite filler to go ahead and do this. But if you put too much pressure, if you go too fast, then you will get clogging of that tip. So there is a little bit of a learning curve that you need to master. Once you master it, you can see this goes fairly quickly around each tooth. We go ahead and go from anywhere from 3 to 5 areas per tooth, starting in the papilla, halfway down between the papilla and the apex, and then at the apex, and then work our way up to the other tooth here. We generally go with a healthy tooth on either side. Here we're just going from cuspid to cuspid. We'll go back later and treat some of those other recessed areas on the posterior teeth. Much easier to see these on this patient here. Then we go ahead, whatever's left in that syringe, we don't waste it. We're going to go ahead and really drive some of this calcium hydroxylapatite, these microspheres, into the recessed areas of the teeth. Why is that? Because this is going to keep the elimination of that hypersensitivity, literally plugging up the dental tubules. Calcium is by far the most effective way to go ahead and do this, by pumicing this right into to cover those dental tubules and create the plug. But the constant release of calcium ions from the tissue, that's what gives you long-term hypersensitivity, and it is just amazing here.
All right, so that is the gum builder treatment, and now I want to go ahead and let's go to the black triangle treatment on her. Also, same visit. We're gonna keep going on her. That pumicing, though, of that material into the recessed areas on the teeth, that's what eliminates the hypersensitivity, and that's that calcium getting really pumiced right into the dental tubules that are really sensitive. And patients love that. Let's go to the next video.
Now it's on to black triangles. Take a look at the technique. This is different. This is going in there using the tip of your needle as a scalpel. Look at that back and forth motion. What are we doing in the papilla when we do that? We're creating space. Now, this is the second treatment for black triangles on this patient here. And she already has a lot more papilla to work with, which means we're going to get an even better result as we volumize this. And that's what we're doing. We are placing some of the calcium hydroxylapatite. We're using this. We can also use hyaluronic acid. In this case, we're just going to use what we've been using till now. And now we go back and forth, back and forth, back and forth. Add some, it'll come out that same hole. That's how you know that you are, that it's filled as much it's really going to go ahead and take. And we're going to go back later and see if we can add a little bit more, and then we are going to shape it. Notice the Q-tip on the lingual here. That is to prevent it from going out the lingual, more than going out the lingual, from volumizing that out the lingual. Now let's go to the next one. Same thing. We are going to go ahead and go back and forth, back and forth, back and forth, staying within the gingiva and creating some space. That's exactly what we're doing. And then we are going to go ahead and use some of this calcium hydroxylapatite to volumize. In this case, here we're placing that Q-tip on the back of the lingual, putting pressure on the back of the lingual papilla so that it's not going to push the lingual papilla out. We don't want that. We want it to go up. And that's exactly what we're doing. You can also go ahead and go bevel up and also angle up a little bit, because that's the direction that you want to go ahead and fill this. So we want to do this. We don't care if some of it comes out. That's okay. That just tell me it's not going to accept any more of this right now. And then we are going to go ahead and start to shape this. And again, keep that on the lingual. So we go ahead and really push this in there and really start to shape it. We are putting a lot of pressure on that filler to keep pushing that papilla up. That's what we want to go ahead and accomplish this. It's fairly simple treatment once you get the hang of it, like anything else, and understanding how you can really close up black triangles. Now, first time we used actually calcium hyaluronic acid on that second papilla right here. We're going to see if we can get a little bit more in there. It's okay to use hyaluronic acid. On the first, second appointment, we used that very, very successfully. You can mix and match. This time, we just had the calcium hydroxylapatite ready to go. The Kaha filler, and might as well just use that. So you can certainly mix and match and get good results here. Now let's show you again where we started, and this is her at baseline. You can clearly see those black triangles, but also take a look at all that recession and the very thin attached gingiva that she had that we started with when we first started her treatment, and the hypersensitivity it certainly comes along with it. That's really thin attached gingiva. Now let's show you the after and take a look at those black triangles that are really successfully closed up. But look at how much more attached gingiva there is on this patient all the way around. And specifically, take a look at some of the recessed areas that have really started to close up or are really minimized, because that attached gingiva not just growing up to cover the recessed areas, but is also growing down towards the vestibule. So we have a much, much better attached gingiva, the quality and the quantity of it and the height of it there as well. And here you can really see with those arrows what we have done. Look at the cuspid on the one side, and you can clearly see that that recessed area is gone, and she's got a lot more attached gingiva everywhere. I mean, you can see it, and then look at the black triangles. Those are really, really covered up. And with the second treatment, this is just going to get better and better. But again, want you to really appreciate, especially when it comes to the central incisors, for example. That's a lot of recession that she has had there. Look at the before and after. And if you look carefully at the before and after, you can see she's gained a couple of millimeters for sure, at least on all of these teeth, but specifically around the central incisors, because it's hard to tell the difference, right? Because she's got so much recession there. But if you look closely, this is starting to happen for her. So with the second treatment, with continued time for collagen biostimulation, and she is going to get some root coverage. Now, how much? Only time will tell for all this. But as the alternative to surgery, or as the number one treatment for gum recession, mild or moderate for sure, and even for severe recession, you cannot beat the gum builder. Now, she can always go back and have surgery later on, without a doubt, have that at any time. Why she would want it now? Who knows? Because this treatment is working very, very well for her. You need to offer this to your patients. And when you talk to patients about gingival recession, hypersensitivity, black triangles, you've got to put gum builder into the mix, because that's proper informed consent. Compare it to surgery and give everybody the risks and benefits for both. It doesn't make a difference to me what they pick, because I do surgery there as well. I mean, so we can deliver all of that, but you've got to give a patient all of the available options, and they love the non-surgical option. So it's time for you to get AAFE certification trained today on gum builder and black triangle treatment.
All right, we're going to go ahead and answer all your questions. I know there are a whole bunch of questions, so we're going to go ahead and answer all of your questions, but let's go through this a little more, because some of that will probably answer your questions there too. Let me just get this going. So again, we'll just show you some of the before and afters that we've got here. But I mean, I get really excited about a lot of things. I mean, I certainly love all the facial stuff and that kind of thing, but I get really excited about all these things. So this has been a problem for so long. Let me turn on my video so you can see me. So you should be able to see me now. Neil, can you see me? Can you guys see me? Yeah, okay. It looks like I'm back. I mean, there is so much we can do. Look at those before and afters, and here you can really see black triangles are gone, but this is starting to creep up. Now, am I going to get full coverage? No. How long has she said no to surgery? A long, long time, as you're going to see, because I'm going to show you her patient interview here. But here you can see Pore deficient attached gingiva, 2 to 3 millimeter increase. Black triangles are gone. This is as a result of only 2 months. So that's pretty good. But is the patient excited about this? I'll let you see what the patient says about this. Here we go.
Monica is here. She has had 2 gum builder patients according to our protocol. So we're going to go ahead and take you inside of her mouth here and take a look at her gums and see the results. And they are quite amazing for that. But before that, Monica, let me just ask, and you see we're all bundled up because it is freezing in Cleveland today. Let's go ahead and let's get your perspective of this. First of all, how was the treatment in general? You had 2 rounds of the treatment.
I thought it was very simple, easy. I had no problems, no pain. For myself, I thought I immediately saw a difference.
Right.
They're pink. They're nice and pink. And
right. I mean, is that what you noticed? That's what you mostly noticed.
And I noticed that the teeth that were the worst, the front 2, I noticed right away that you could see a little bit of change.
Right.
Yep.
Right. So she's had various teeth that, the 2 front ones had the most recession, but we've seen some improvement. Sensitivity, tooth sensitivity,
Nope,
nothing. So that all that is gone. And she also had some black triangles. She had, because of all that recession, it kind of opened up these black holes between the teeth where you could trap teeth and trap food and trap different kinds of things. So that's closed up substantially. Now we did gum builder and black triangles on her, but are you happy with the treatment, bottom line?
Happy. And I told the girls last week when I was in, I've even started telling friends and people that they should do this instead of alternative things.
Right. And again, just to remind everybody, you were told to have surgery.
Right.
Many times over the years.
Surgery and
you didn't.
Another, and I didn't.
Right.
I'm glad I didn't. So.
Yeah. All right. So it's a great alternative. But let's go ahead and take you inside and see the results after 2 gum builder treatments. And this would be about 3 months out. It's been about a month since her second gum builder treatment. So come on in. Let's go ahead and show you.
And that's pretty much what we just showed you, because that patient was her before and after. But like I was shocked at what she was saying. Now, by the way, she is also a Botox and fillers patient. She has come in and had just about everything. She's a college administrator, but she just loves the whole thing. And this really, really excited her, especially the sensitivity. So, I mean, that's a great... You're stabilizing and reversing gingival recession. You're taking care of black triangles. You're eliminating hypersensitivity. That's a really good, and you're doing it non-surgically. Okay, I mean, that's really incredible. These kinds of cases, these are the mild cases where you can get total root coverage here, and that's what you want. And then I just want to really make a point here. This is what you should be treating. Why in the world, if you've got a little bit of gingival recession, it's only getting worse? Stop waiting, right? I mean, what are we waiting for? You're only waiting for it to get worse. In the past, we've only been waiting for it to get worse enough so that we could recommend surgery, which they are not doing. Okay, so that's not going to help you. So these are the home run cases that you should all be treating. Literally, it's every day in your practice. I mean, literally, it's every day. And you know this. You see these patients every single day, but what did we have to offer them? And again, you're going to see this in various stages, but this is about half closed. That's pretty good. And this is at 2 months out, and that's going to keep getting better and better. And we will go ahead and reapply this usually at 6 months. I think that was one of the questions, but we'll talk about it as we get into it. This is much healthier tissue. You can see the thickness of it. I mean, it's just different thickness, just in length, but also the thickness of it right here. And that's about half closed, and that's at 2 months. That's going to keep going. That is what regenerative periodontal therapy is all about. And so that is really, really significant and really what we want. This is again, another really great case that was at 2 months out, and it's going to keep getting better and better over time. So these are the kinds of things that all of you can do. But the amazing thing is, and Neil, I'm going to have you talk through this very short clip here. It's not a matter of using it this non-surgical versus surgery. How about Dr. Valens, who's using this during surgery right here? And this is your clip here. So tell us what's going on here, Neil.
We did a surgical procedure here. And once we did the flap and the suturing, we had a little gum builder. It eliminated all the inflammation, and it gave a tighter band of tissue post-surgically. So it can also be used on surgery patients as well.
Right. And what was the surgery that you did here? This is just a.
We did a basic flap surgery to gain access to the bone and clean the roots of the teeth. Once we put the tissue back, we did gum builder around the margins of the teeth. We got a much better result, long-lasting, tighter, and pinker tissue. So it can be used in so many applications. It's great.
Right. And by the way, look how fast. I mean, when you get good at this, this is fast. I mean, this is really fast. And you also see no clogging. So it's really just once you develop that feel, and again, the 29 gauge has eliminated most of that clogging. Don't push against the bone and go a little slower than Neil does. But once you get that feel, it really goes pretty quick for all of that. But
you could also use this procedure. You put a new crown in, and you can use it around the new crown.
Right. Yeah. I mean, you can pretty much use it just about anywhere. And again, that's what we've learned from Neil and all these applications. So let's go ahead and talk about patient fees, and we'll show you the dental codes. But the dental codes really need explanation when you submit these. For that we go through in the entire course, and then we're going to take some questions, and then some of you want to see a Botox case. I've got a cool Botox case which we can show you there as well. All right, so let's now talk about the profitability. This is the material you're going to buy. StatDDS is where you're going to get it. They're the exclusive distributors for the material Radiesse. This is the Caja filler. Again, I promise you we will go back and answer questions here. So StatDDS is the exclusive distributor in dentistry for Radiesse, and also they make a neurotoxin called Xeomin. So that's their contact information. Radiesse Plus comes 2 syringes in the box. It's $385 per 1.5 ml syringe is your cost. It comes 2 syringes in a box, so it's probably almost an $800 box. But each syringe treats approximately 20 to 30 teeth. You're going to backfill the smaller ComfortDoc syringes using sterile technique with the big syringe. So you're not taking the big syringe to the patient's mouth because that would be way too costly and you would contaminate it. So you're not going to do that. The average cost of material is about $12.75 a tooth. Some a little bit more, some a little bit less for that, but that's the approximate cost for that. The syringe is approximately to you $4,000 in production. So if you go ahead, you can get 20 to 30 teeth, and you're, well, I guess that's the next slide. You are charging anywhere between $125 to $150 per tooth. That pretty much is about $4,000 average in production. Sometimes a little more, sometimes a little less, depending on what you charge the patient. Highest ROI based on time and price. There's nothing else in dentistry that comes close to the ROI on this based on the time and based on the cost of the product for that. So it's really amazing. This is a very highly profitable procedure for this. Again, paralysis by analysis. You got to get past it. This is the kind of thing that you jump in. You've got all these patients in your practice right now that need this, okay? And many of them that want this. 88% patient acceptance is what we see across in the AAFE across, and we've trained over 3,000 dentists in Gum Builder here already, and they are killing it. For sure. Suggested minimum treatment fee is $125 to $150 per tooth. You can charge per area. I know that does that a lot. I know Neil does. It's amazing because we've got a whole number of periodontists that go ahead and use Gum Builder, and the periodontists are used to like full mouths. So they're doing full mouths of Gum Builder. I'll let Neil talk about that in just a minute here. Or you can have a comprehensive treatment fee for this. It's a very high ROI. Dental insurance codes I'll show you in a minute. The AAFE members are doing, some of them are doing over $30,000 a month just with Gum Builder. The treatment time is literally minutes. And it's a really simple procedure for you to go ahead and do. So talk to this a little bit, Neil, the kind of cases you do and what you charge and that kind of thing.
Well, most of the cases we do are healthy gingival cases. We get about 90% acceptance. We charge anywhere from $750 a quadrant to $3,000 for a full mouth of gum recession. Minimal material use, 1 syringe of Radiesse. You can treat like 5 patients. Usually the patients want the treatment right at that visit. It takes nothing to download the syringe into the Comfortox things, and you're ready to roll. And the fact is, you're taking away the fear of further gum recession. Most of these patients are fearful. They come in, I'm sure you've heard, you get gum recession, they're going to lose their teeth. This alleviates the fear. And if you can alleviate the fear of a patient, it's worth everything. That's the bottom line.
Right.
It's a really easy, painless, it's a great procedure. Great.
But I want to go to that because you're a periodontist, and I don't think that most dentists, most dentists will tell a patient, "Oh, you have gingival recession. Let's just kind of watch it," and that kind of stuff. But yeah, you see these patients, and you see periodontal patients there too. Patients are not accepting, let's watch my gum recession get worse, right? I mean, I think you hit it right. A lot of patients will just not say anything. They may even leave your practice because they're fearful of their gum recession. They do not want to lose their teeth. Is that what you find? Did you freeze up there, Neil? Okay, Neil, if you can hear us, then you may have to log out and log back in because your video is frozen. I'm assuming the rest of you can hear me. Can you guys hear me? But we kind of lost Neil somewhere there. I think we lost Neil because you can hear me, but I don't think Neil is. Maybe I think if he can hear me, he'll log out and log back in. But I will tell you that this is absolutely true. He hit it on the head for that. Many patients are fearful of they're not buying, let's just watch my gingival recession get worse over time. They want to do something. They don't want to do surgery. They don't want to get into all that, but they absolutely want to go ahead and do something here. All right, so hopefully he'll log back on for this. So let's talk about dental insurance codes. And I promise again, we will answer all of your questions. Congratulations to the 12 or 13 of you that have already grabbed packages. I'll announce your names in just a little bit. Dental codes and dental insurance. These are the two most common ones. Dental insurances are paying this more and more, and it just depends on the patient's plan. There's a lot more that goes into it. We cover this in the full course, whether it's the on-demand course or the live patient course. For that, you've got to know how to go ahead and submit this to insurance. It comes away again. You have a little blurb that's pre-prepared that you may have to send along for this. But I actually spoke at the MetLife Dental Advisory Board. MetLife, who you all may know, whom you all may love, or you all may hate because it's dental insurance. But they are very nice people. But they have a big dental advisory board meeting that I spoke at a few months ago, and they're all over this, and they say it just depends on the depends on the plan. I mean, what depends on what the employer bought and whether or not it's covered. But they said more and more are covering it because these codes have been around for a while. So now we've got a material that fits these codes for that. D2991 probably works where most dental insurance is better than 4265, but they've been paying on both for this. And the incredible thing, the UCR that most AAFE dentists are finding is about $150 per tooth. Initially, they were charging the patient less, but then these UCRs were coming in at more. So that was pretty interesting. So again, the dental showdown, there's no question. Again, you're paying $39.97 for 3 courses here, not $47.97. Compared to everything else, you should be doing everything else. You should learn all of this, but you got to learn something that's going to go ahead and be profitable right now. And that's going to be gum builder. It's also going to be injectables like Botox and fillers. And again, we've trained thousands of dentists on this. And again, this almost lets you do this because again, you're not going to be doing that many cases of this, even though they're big cases, but they also take a tremendous amount of time and lab fees and everything else for that. So there is no comparison, and the career ROI and the time to implement and this includes gum builder, is so low compared to Invisalign and again, not knocking any of this stuff. We do all this stuff in our dental practices. And implants, the time to implement is substantial. You buy a big machine, right? You buy a CEREC or something like that. That time to implement is serious time to go ahead and do this. So this is about giving patients literally what they want. I'll just give you a little bit of the economics again, then we'll get to I'll put up the packages again for those of you who want, and then we'll spend time answering some questions. And then those of you that want, we'll show you a Botox video here too for this. So no question, nothing comes close to injectables. And your first 5 or 6 patients will go ahead and pay for your Botox and filler training for that. And we will push you to start treating paying patients in 14 days following the training. You've got to do the work, but we will give you all the resources and push you to do that. Stop the paralysis by analysis. If had you done this, I get dentists that tell me all the time, I wish I would have started this like 2 years ago. Yeah. So here you are now. Don't wait another 2 years. Say, oh man, I wish I would have started this 2, 3 years ago for this, because we do office production study surveys, and this is for Botox and fillers. AV dentists who add Botox and fillers to their services are seeing an average of additional production of $32,500, $32,500 a month in additional production. There are some who do less. There are some who do a lot more. I mean, I could show you many dentists who are doing $50,000, $75,000 just of Botox and fillers, because there's no other office that has so many patients coming in on a regular basis to their office than a dental office. If you got a regular full schedule and a hygiene schedule, you're seeing 100 patients a week, maybe more, okay, maybe less. But they're already getting Botox and fillers somewhere else. They might as well be getting it for you. If you add TMJ oral facial pain, that comes out to $52,500 a month. We have all these different courses you can choose from. Again, if you're just getting started, you're going to start with the level 1 Botox and fillers and TMJ oral facial pain. Go to afedentist.com. Well, when I get to the packages in a second, I'll tell you who has bought so far, and congratulations to all of you. Greatest faculty in the world, locations all over the place. Don't worry about locations, just lock in a package and you will go ahead and get the location that you want. And let me go ahead. If you're just getting started, then the 3 courses that you can take are going to be probably level 1 Botox, level 1 fillers, level 1 TMJ oral facial pain, or gum builder if you want to switch that out. Advanced, you're at level 2. If you're really master and you've been doing this for a while, our level 3 courses are going to be for you, as well as gum builder here too. And here are the packages again. Let me just read who has gotten. I'll just give the first names here, but congratulations to Martin and Michelle and Carly and Catherine and Brian, all people that have signed up today, and Jenny and Elizabeth and Kristen. I hope I get all these names. Rami and Maria. Maria or Mariah, if it's not Mariah Carey, but it might be Mariah, Heather, Jennifer, Hamza, Jessica, Ella, and Garrick. I don't even know how many of those were, so there are a few left of these packages here, but the all-in package, $39.97, any 3 live patient certification courses. This is the only place you're going to get all these bonuses. You can go on the AAFE website. You're not going to get it anywhere else. You choose the 3 live patient certification courses. It can be level 1 Botox, level 1 filler, level 2, level 3. It can be TMJ, it can be gum builder. I'm sure they will add on a 4th course for you, because we do have these training days that will have all 4 of those courses together. If you just want the live gum builder certification training, the live patient gum builder certification training, then you can go ahead, go to the QR code, and you'll find all these there. Choose your location. You make sure you use Gum 200 when you check out, and then if you just want the online, and let's say you can't get to a live patient gum builder just yet, at least start with the online. You can always apply that tuition, and that's deeply discounted now too to get started, that tuition to a live patient gum builder certification training a little bit later on. Here's just the gum builder live patient courses coming up. And again, all these, the stars mean that you'll also get level 1 Botox and fillers and TMJ on those days too. So you can combine a lot of training in you don't have to spend a lot of time outside of your office. They make it really easy. And this is the big package that includes all these bonuses, which you can go ahead and see. I'm sorry if I missed your name. So I think I got all the names that were there. So there are a couple of patients packages left. So I'm going to keep this. Let me keep this one up again for right now. Let me answer some questions. I'm sorry we lost Neil.
No, I'm back.
Oh, you're back. Okay, great.
Louis, if I go, my internet's going out. Give them my cell number. If they have any questions, they can text me.
Yeah, okay. Or I'll post you maybe your email or something like that.
Yeah, I don't mind that at
That
all.
sounds
Okay.
good.
Yeah.
Okay, but for right now you're here. We may get these questions in. Let me
Okay.
get some questions for that. Okay, and we've talked about this for some of this. We talked about patient fees for this, and again, we'll combine if we're doing gum builder and black triangles. So we'll probably do some kind of combination fee. But I mean, Neil talked about his fees before for this, but we're at about $150 a tooth. And also remember one thing that's really important about gum builder. There's no such thing as a one tooth case. You're always treating, let's say one tooth has got the recession. You're always treating one healthy tooth on either side because you need that healthy tissue to generate collagen that's going to fold in to the tooth that really needs it. Now, if I've got four anterior teeth, lowers, let's say, that have gum recession, I'm going to treat one that's a six tooth case and onward and onward for that. But this is a great question. It was and Neil, you can answer this. What if the patient eventually decides to pursue surgical option of gum coverage? Will this impede that? I'll let you.
No, not
Yep.
at all. It's no
Right.
different than when we do radius or threads and then want to have a facelift later on. There's
Right.
no impediment at all.
Our experience is even more than that, and that's true. But even more than that is you're dealing with healthier tissue if you do a gun.
Exactly.
If
You
you
know,
if you then pursue the surgical option, healthier tissue is always going to give you a better result for the surgical option too. So that's it. And we actually have a couple of periodontists that are in the study that told me they're doing that already. To prepare them for surgery, they're doing some gum builder ahead of time because the tissue is pretty thin. So they want 2 or 3 months of gum builder in there to generate some collagen to make the tissue healthier and a little bit thicker so that when they do the surgery, it's actually better for them.
exactly.
Yeah.
You know,
Yeah,
the
go ahead,
the
Neil.
key to all of this is presentation. We tell a patient, you've had the gum recession for a while. I'm sure you're aware of it. We try to avoid doing surgery. We now have a means to treat this non-surgically. So it makes the patient know that you've been aware of their gum recession, that you've been watching it, and now you have a means to treat non-surgically, and 95% will go through it. As long as they're aware that you knew they had gum recession prior to this, and now you have a non-surgical means, they're all going to go through it, every single one of them.
Yeah, that's for sure. I mean, they'll take non. Hey, listen, if you were patients, you would also want non-surgical over surgical. I mean, again, you gotta stop thinking like a dentist and start thinking like a patient. And again, stop the
Exactly.
paralysis by analysis. I mean, we know this works. This again has been around since 2003 for that. Will the filler migrate? Not if it's properly placed. If it's improperly placed
No.
and it gets into the soft tissue and you're not in the attached gingiva, then it can migrate. And I think somebody on our AAFE forums posted migration into the vestibule, but that may have been, I don't remember if that was gum builder. Sometimes if you use radius for the jaw and you're too deep, that can also get into the vestibule. So but of that, and most of the time that's just going to resolve all on its own for that. Can you place radius for gum black triangles without additional training? Yeah, but it needs some training. I mean, there's a technique, there's a real technique to it. You've just saw the beginnings, but you certainly can try. But at least take the online gum builder course, which will cover black triangles for that. It all needs training to really get good results. It all needs some training. And if you're doing that for black triangles, you might as well be doing gum builder. That's where the real magic happens for that. How long do you have to use the syringe before it expires? They all have expiration dates a few years out. So your syringes should not be sitting on the shelf for very long. We do a ton of this, and again, AAFE dentists do a ton of this, and they're going through syringes pretty quickly. I mean, why wouldn't you? Don't have it sitting on the shelf, right?
Right.
Um,
Once
you
you
know,
take the course, I guarantee by the end of the course, you'll be proficient in this. No questions asked. You'll have no problems.
yeah.
It's really
How much? Right. How much you charge for Botox per unit? We charge about, I think, $11 to $12 of Botox per unit. A brand name of the hyaluronic acid. So a few people asked, can you use a hyaluronic acid filler like a Juvederm for black triangles. You can't use it for gum builder because it has no regenerative substance to it. That's only going to be the calcium hydroxylapatite CAHA radius filler for that. But you can use hyaluronic acid, and we actually have show cases using hyaluronic acid, and it works fine. It works just as good. We've gone pretty much completely to the radius because even in black triangles, we're getting some of that collagen biostimulation that's filling up this papilla that's lasting a longer time. Because your hyaluronic acid fillers like a Juvederm are going to last for 6 months. It's just not going to last as long for that. We absolutely certify RDHs. I mean, and there are states now that RDH instead what we found, we don't know this, it just depends on your state. We have found in the states where dental hygienists can do laser treatment and that kind of stuff, they can use gum builder. Okay, it's going to vary state by state. There are now 7 or 8 states where dental hygienists can now do Botox and fillers in the face, and TMJ oral and trigger point therapy. Certainly those, that's not even a question that dental hygienists can perform this treatment for that. So it's that. The other filler that we use would be a Juvederm, would be just about anything else for that. The pricing is whatever price is tonight, whatever you paid before. I think that's an AAFE question for that. If I'm not saying that, if you take the online gun builder course, for some of you, that's going to be enough. I mean, that's going to be enough to get started, learn the technique, and then, kind of work through it. We offer both online gum builder certification and live patient gum builder certification. A lot of dentists just want to really practice, under somebody like Neil, really get the feel for it. You can absolutely take the online gum builder certification and then try it out, and some of you will be successful with it. It's just whatever you want. But the online gum builder certification, for some of you, if you've done surgery, if you've worked a lot in gums, if you've given Botox and fillers before, absolutely you can at least start with the online gum builder certification. Then you can always, if you ever want to later come to a live patient gum builder certification, you can apply it to that for this. This is a good question. What type of patients are these contraindicated for, Neil?
None. Yeah, you can do them on every single patient. There's no
I would just say every single healthy patient. Right.
Every single healthy patient.
Periodontal disease. Right. You can absolutely do this in California. This is in the mouth treatment, and you can do Botox and fillers as a dentist in California. We will show you exactly how to document and do it for Botox and fillers. We've been teaching Botox and fillers to dentists in California since 2010. We've had state dental board members take the course for that. Let's take a look here. Let me take a look. Am I allowed to use the technique with Botox and fillers trainings with certificate in the past? Yeah, you can do whatever you want, I guess, but you should at least get the online certification training so you can really go through that. All right, let's see what else is here. How about restoring the missing tooth structure? Reason fills. I'm not exactly sure I know what that means, Ron. Figure on into this. You can fill up these black triangles with composite. You can do these cervical lesions with composite. You can do any of those things. I'm not exactly sure what the question is there. If you want to re-ask it, that would be great. I think I've seen just about everything. And if not, if I missed it, yeah, you can email me, and then we can connect you to Neil.
My email.
Yeah.
If the gum is inflamed, I'd reduce the inflammation before I did the procedure. I just saw that.
That's for sure.
Yeah, so do scaling and root planing first. When you reduce the inflammation, you'll get a much better result with the gum builder.
Right. Yes, we have informed consent for all this. Absolutely. We don't touch any of this without informed consent on any procedure that we do. That in my offices, any procedure, dental, face, Botox treatment, all these things. Yes, you can treat patients with stable perio for sure. How is it around implants, Neil?
It's fine. Treat the implants the same as natural tooth.
It's great around implants. You've got so many black triangles and recession. And implants are teeth, right? And what are we seeing now? We always joke, when I teach implants, we always kind of joke about, when is the best time for, get into implants? And then when should you retire once you start offering implants? 5 years. Put in all the
Right.
implants you want for 5 years and then get out, because then they're going to be just like teeth and you're going to get peri-implantitis. That's just a joke. Don't get out. But, that's a lot of dentists have done that. Okay, I'm retiring now. I put in all these implants and now they're all coming back with periodontal problems. I'm out of here for that. It's great around. Gum Builder is fantastic around implants. It will save you time and time again, because when you have recession, when you have got gingival deficiencies around implants, that is a huge headache, and Gum Builder has been fantastic. You can use it on the head and neck cancer patients who undergo radiation therapy with no issues. We recommend at least 2 sessions to most patients, and they're paying per session, or you just give them a whole package deal for that. When we use, again, Kaha, we use Kaha now most of the time. We don't use hyaluronic acid anymore for the most part. We show it, but we don't really do it. We do Kaha most of the time because of the collagen biostimulation is what we really want. I think I've gotten all the questions for this. Okay, we've answered these and these, but keep asking. Let me show a Botox case. A bunch of you want to see the Botox case here, but we had a few more come in, so I'll try to read the names before we sign off. But if you want these last packages, again, they're only 20 and it's only till midnight tonight, then go ahead and get it. Let me show you a Botox case here, but again, there's my information again. If you have any questions for Neil, email me and I'll put you guys in touch for that. But all the packages you can see at AAFEdentist.com. All right, let's show you a quick Botox video for those of you who've never seen it. There, Neil, if you want to stay on, or you can stay on for a few more minutes, or you can take off. We really appreciate you being here.
My pleasure.
All right, let me go ahead and show you a Botox video. All right, thanks, Neil.
Okay, Denise is here and she is ready for toxin here. So what Jill is doing is she is going to go ahead and mark her up. She'll get a good sense of her. She's looking at the temporal fusion lines.
Fight really hard.
And I'm just going along with what she's doing here. So she's looking at temporal fusion lines, which is going to be where your ends of the frontalis are going to be. Oh my God, Denise, look how active your frontalis is. Denise does she usually get this bad here after she's been coming in every 3 months for a while, right, Denise?
Mm-hmm. She's usually like this.
Yeah.
She just has like pretty strong.
Yeah, she's got very strong muscles. She's very expressive. And so now we're going to do crow's feet. And Jill, you like to mark up, right?
I do.
You like to mark up every single patient. That is provide your preference on that. And it really helps you. It really does help you. So you can really get a good idea here. So counting up, how many units are we doing in her frontalis, Jill?
16 units.
16 units. And so now I just want to go with that. How many dots did you count up?
She has 11 dots, and I use tight dilution. So you can see I have 16 hash marks, and I'm going to pull this back to 22 total hash marks. And then I'm going to push 2 hash marks per injection site.
Right. So if you don't know how to go ahead and dilute your toxin, then you gotta learn it, because Jill loves to use 1-to-1 dilution, right? Is that what you pulled out?
Yeah.
1-to-1 dilution. If you don't know what 1-to-1 dilution is, then it's time for a level 2 course in the AAFE, where we teach tight dilution and then different dilutions as you go up. All right, let's talk about the procedure. So she has determined exactly where to get the best spread of the botulinum toxin that she is using. And in this case, you are using Xeomin here. And this is we bumped her up a little bit over last time, or this is the same as last time?
This is the same as last time.
Okay, this is the same as last time, and using ComfortDoc syringes, and those are the most comfortable by far. That's why they're going in so easily into the forehead. How was that, Denise?
Easy.
Yeah, she's easy peasy. She's done this before. Wiping up and away from the eyes always is the way you're going to get the best results. And now glabellar area, and we are going to go ahead and she's going to grab it, isolate it, go in and give it how many units, Jill?
We're giving her 20 across the glabellar.
20 across the glabellar area here. Alexa, stop. I don't know why Alexa keeps coming on here. Look how she is holding this tissue here. She is really going to make sure it stays in the corrugator muscle here. And here you can see the other side there going as well. And Denise knows not to go ahead and touch her face here. By the way, take a look. Denise has got very deep set eyes, and that's a really good thing, certainly a good thing. And that's why she can get 16 units in her frontalis without any worry about an eyebrow drop here as well. So now what are we doing here, Jill?
We are doing 14 units total.
Okay, and her crow's feet.
Mhm.
And that is going to be always away from the eye is the way we like to go ahead and do it here. And we're just going to go all the way around to make sure you get that lateral orbicularis oculi here. And she is doing great. And where are we going next?
Just the other side. and then we're
Other
done.
side. Okay, other side, and then we're done. There you can see some of the venous complex there. So we're just going to try to stay away from some of it. Patients can bruise. That's normal and acceptable for all this. Alexa, stop. We're talking here, Alexa. Okay, but we're almost done here anyway. And you can go ahead and see that. So this is a very quick, really quick treatment for Denise here. Denise, do you like getting neurotoxin?
Love it.
Yep, she always loves it. And that's always good. How long? So tell everybody, how long does it take to kick in on you, Denise?
Probably about 2 weeks, 4 weeks is like the
Yeah.
spot.
Is the spot when it really is really, but you start noticing a difference like
Almost right. I'd say within the first week, I notice a difference.
Okay. And then she will be back for more. And you coming, are you coming to get some work next week?
I am.
And we have a faculty summit next week where we train the faculty on all kinds of things. And what's she gonna get? She's gonna get
Temple filler.
temple filler.
Mhm.
So we are going to bring you the latest techniques, so you will see Denise's face there again. All right, thank you very much. That didn't take long. This is not even a 5-minute video. Look how much you can accomplish in 5 minutes. All right, Denise, say goodbye to everybody.
Bye,
All
everybody.
right,
Thank
see her
you.
again. Jill, say goodbye to everybody.
Bye, everybody.
Okay, they love when we do these videos together. All right, thank you both. We had to share Denise's before and after. She's a repeat neurotoxin patient, has been getting it for a while, and her face just looks different. It's relaxed, it's smooth, and she absolutely loves what it does to her face. Also, a little bit of oral facial pain. She goes through her neurotoxin and her fillers pretty quickly because she is an athlete, and athletes have higher metabolism. Even at 3 months, you can see that it pretty much disappears completely. So recognize that on your patients there as well. She'll be coming every 3 months, sometimes get a little longer effect, but she's a great patient, gets a great result, and it's time for you to really up your game with the foundational and advanced procedures of neurotoxin for your patients so you can get the best AAFE results possible. All righty, and so I just to give you a little bit of what that looks like. So again, avdentist.com. Grab the last packages. Congratulations to all of you that signed up. Let me just see if there are any final questions here, and then we will. We really appreciate you all taking the time to be on. We've had a lot of you on here for a long time. Really appreciate it. Radius is sold by statdds.com. We'll show you that in just a second, so you can go ahead and see that. And can I please talk about treating large, strong frontal areas with very hooded eyes? Yes, you've got to treat them very, very carefully for that, and that's a little bit more advanced for that. And you've got to stay within middle forehead to upper forehead because if you get too low, then that's going to make the eyes even more hooded. For that, you've got to be really careful. It's really more about the frown lines and that kind of thing for that. But you've really got to assess those hooded eyes for sure for that. What's the charge for that procedure that we just did on Denise? I think that's what your question is. What she probably right there had $600 to $700 of neurotoxin. How long did that take? It was a 5-minute appointment. Maybe 10 minutes with chit chat or whatever. So you've got to get into Botox and fillers for sure. That should be part of it for that. But patients they come 3 months for Botox, 6 months for fillers. That's generally what they come when they are coming back for that. Neurotoxin, like Botox, can last anywhere from 3 to 4 months, and they come back over and over and over again. That gal, she is Denise, has been a great patient. I don't know, we probably see her for 7 years. She has probably spent
I couldn't even guess how many tens of thousands of dollars in our office. I mean, you absolutely have got to do this. This is the investment that will pay you back so quickly. There's nothing else like it in dentistry. And like I said before, when it comes to Botox and when it comes to gingival recession, okay, gingival recession will apply to 57% of your patients. That's way more than implants, okay? And again, there's no lab fee. There's none of that, right? They don't have to deal with insurance. There's no lab fee. The Botox and fillers, I mean, it's minutes to go ahead and accomplish that. I mean, literally, and that's all elective, right? There's not, you can't even bill for dental codes for Botox and fillers, and they're paying somebody else right now. Your patients, you just start asking your patients over the next few days, have you ever gotten Botox and fillers? And you know what you're going to hear from some of your patients? You're going to be shocked because some of them are going to say, yeah, I've been getting it for years. I go every 3 months. I go every 6 months for Botox and fillers. And you've been bothering them to go ahead and fix and get a crown on tooth number 19 for that same 3 years. And they told you they don't have the money because they're spending it on what they want. It's pretty much that it is. They might as well spend it in your office. We see that all the times for that. And we give tons of free webinars. Go to afewebinars.com. I'll show you that. For that, we cover all complications in the course, complications management with Botox with good technique. There's very few complications with fillers with good technique. There's very few complications other than you're going to get a little bit of swelling, you're going to get a little bit of bruising. Those are the main complications over and over and over again for that. But those aren't free webinars are not training webinars in Botox and fillers. That you really need a lot. You need live patient training for Botox and fillers. The online gum builder course, I think, is like an 8 or 9 hour CE course for that. It's a really intensive course for the online gum builder certification course for that. Any consideration for after a procedure besides not brushing for 3 days? No, brush, yes. Not flossing, okay? No problem with eating. We don't want them to smoke ever. You don't want them to smoke after a freshly placed gum builder because they got little holes in their gums that will heal up within not even a day. I mean, not even a day, and they're going to go ahead and heal up for this. Coffee is okay. Nothing. We never want anything super hot or super cold for post any procedure in the mouth, really, especially when you're dealing with gums. But yes, brushing, light brushing, no flossing for that. But otherwise, not much else that they have to really worry about. Further about the hyperdilution of radius, is it okay for us to pure or needs to be diluted when applying it to the gum? So in the course, we go through this. There are times when you may want to dilute it. Most of the time, you're using the radius right out of the syringe into the ComfortTox syringe. There are special times that we go through in the course where we may dilute the radius to make it a little thinner because we want a wider spread. But again, most of the time it's just pure radius that's going to go in. Make sure you're using the right syringe, 29 gauge. Make sure you're going a little bit of a slow application and you're not right against bone, which you shouldn't be anyway for that. How long? No flossing, a couple of days. That's about it. And again, I mean, I always joke with the patients, by the way, same joke to the patients is, you don't floss anyway. I'm going to tell you not to floss for a couple of days, so at least you don't have to feel guilty about it. After a couple of days, you should feel guilty about it and go and start flossing. Maybe it'll stimulate you to go ahead and floss for that. Can we do these treatments in immunocompromised cancer patients on chemotherapy? For sure. There will not be any problem. They may not heal as well, but as you saw, these little punctures, it's great on immunocompromised patients because what else are you going to do? Okay, they'll from all the little injections of gum builder, they will go ahead and heal up with not a problem. Surgery, obviously, you're not going to do on that, but make sure that they're clean. Make sure that it's really well scaled. We're not talking about if they have periodontal disease. We're talking about, as healthy as they can get your gums for that. Amy, it should be working. Email, I'm going to tell you who the email. That Gum 200 should be working. I know the AAFE tested it out before, but let me tell you too, go ahead and email this email, register at facialesthetics.org. I put that now. I probably messed it up. Hang on a second. Okay, let's see if I got this right or wrong. Oh, I got it. I really got it wrong. Register at facialesthetics.org. Okay, now you saw my typing skills at work. So if you have a problem, Amy, email them right now and tell them you tried to register to make sure that they honor that GUM 200 tomorrow, and they'll get you into the course without a problem here. Okay. How often do you have to repeat the treatment after 1 year? Again, we see them, again, you're going to see them regularly anyway on a 3-month recall, 6-month recall, whatever the normal hygiene recall is. And a lot of times we pull them right off of hygiene and go do another gum builder treatment. Anywhere between 6 months to a year is when we're going to go ahead and see it. It's usually, again, the training course will take you through all of this. It's usually first appointment, a month later, second appointment, 2 applications of gum builder on most patients. Fill any black triangles in that same time there as well. And then we will see them maybe at 3 months to see if it's moving along, but usually at their next recall appointment, see how it's moving along, and then kind of monitor them from there for that. So that's really good. Let's take a look. I think Midwinter in Chicago is doing 2-day hands-on Botox filler course sponsored by the AAFE. I don't know if the AAFE is at Chicago Midwinter. The AAFE has a Chicago training center where we give these courses all the time, but I don't think they're at the Chicago Midwinter this year. Maybe somebody else. You're definitely not going to get the resources that you're going to get from any other organization. Nobody has community forums like what we have. Nobody has any of those things. But we give Botox and filler training all over the country. We have a Chicago training center where we give it almost weekly. So you can definitely check with the AAFE for that. Register at facialesthetics.org if you want to email. I'll put up the next slide and you can go there. We don't have a training center in California, but we give courses there all the time, including gum builder courses for that. What's covered in level 2 and level 3? Go on to the AAFE website or email. Let me see if I can put in the right email. And they can tell you exactly what's covered. But just generally, I will tell you what is covered. It's going to be more areas, more complicated areas, more comprehensive areas. Any questions like that, definitely go to register at facialesthetics.org. So, and they can get you. But as you get to, for neurotoxin, we start up here. These are the most common procedures. When you get to level 2, you start to move down the face with more muscles. Level 3, you're doing comprehensive full face neurotoxin cases, and down the neck for that. So that's how that is for Botox. With fillers, same kind of thing. Fillers, most of the fillers you're going to put in are down here, and now all of a sudden you're going to go to full face. You can reshape the face with Botox and fillers. It's amazing. I will tell you one thing about the AAFE curriculum, because we survey all of these, we survey our members all the time for that. We see this all the time. I showed you after people took a level 1, what let me see if I can find it again here. This is this one. This is after level 1. We surveyed 1,000 AAFE dentists after they took level 1. They took Botox and fillers. The average we're doing, in addition to their regular dental production, $32,500 per month in additional production after level 1. If they also did TMJ oral facial pain training, their average was $52,000 a month in injectable services in addition to that. Some were doing less, some were doing more. That's why this is an average. Level 2 and level 3, I mean, they're doing bigger cases constantly. They're doing much more comprehensive cases. I would say a lot of those cases are easily $5,000, $6,000 just in injectable services, head, face, and neck. I mean they may not do it all at one time. They usually will go ahead and treatment sequence over a few appointments to that, but they're presenting a lot bigger cases, just like anything else. When you learn implants, again, I've taught implants, I've taught all kinds of things, veneers. You know, when you start doing veneers, we start doing Invisalign, you start on the easier cases, you get some experience, you take more advanced training, you're doing bigger cases. All of a sudden, if you go through an implant curriculum, hopefully then you're really doing the big cases. And there's a love. I've done them. Some of you have done them. A real love-hate relationship with the big cases because yeah, it's a big fee, but it's a big lab fee. It takes hours, hours to go ahead and just plan some of these for that. All the AI and all the new stuff and the best laboratories for that. The best laboratories, I've always believed, take more of your time, right? Because they want to be really precise. I mean, tell me your experience on that if you do big implant cases. Big veneer cases, they're great, but they take a lot of preparation, not preparation just in the mouth. That's almost the easiest part of it, but just planning and planning and planning for that. I mean, just so many different things that this is. I mean, these patients come in and they keep coming in and it's repeatable. It's a recurrent revenue. You don't get recurrent revenue from an implant case. It's one and done. From restorative, from crown and bridge, from Invisalign, it's one and done. That's pretty much. These are constant, just constant for that. You're gonna properly transfer this syringe using a sterile technique. We teach you this in the course, and we do this all the time to a single-use syringe. You're going to backfill it for that, and again, you're going to keep everything sterile. So we'll teach you that in the course for that. We have Los Angeles and San Diego locations. We've got all locations. Again, that map that we showed of locations, we are all over the place. We're in California all the time. We're in all the big states all the time. And we go to a lot of other places there too. Let me just see if there's anything else for that. If you go through a curriculum and you really work on it, it's the most fun. And it's so funny because I just had a bunch of dentists tell me this. Literally, Botox and fillers is the most fun you're ever going to have in dentistry. There's nothing else that's going to come close. It's the most fun you're ever going to have in dentistry. Gum Builder is not far behind because it is so easy. And you're going to see when you start talking seriously to your patients about, gingival recession and they take it seriously, it's a whole different experience. They don't want to lose their teeth. We see that all the time. For that. You can access the online course anytime. Does it expire? Maybe a year out. You can actually ask the AAFE that question for that, but it's a long time that you'll have access to it for sure. I think I got most of the questions here. So thank you so much for being on with you. There's still so many of you on. Really appreciate I really appreciate you being on with us. Do you also go about how to present the treatment of Botox and fillers to patients? You bet. It's easier than anything else. We'll show you how to present it to patients. Patients usually ask you for it. They know Botox. They've had it before. They'll tell you, what they need for that. It's the easiest thing you'll ever present in dentistry. That's for sure. So thank you. So a couple of other ones that came in. So congratulations to Andrea. Congratulations to Brian. Congratulations to Peter. So I don't know how many packages are left. Probably not very many for that. Thank you all for being on. It has been a pleasure. We are on for a long time with you, and you were on with us. So that means the world to all of us. We really do appreciate that for that. So hopefully we will see you on another course real soon. You can always check afewebinars.com. Let me just put up that final slide again. Let's go ahead and get this up. I don't know what's working here. There we go. That's the slide I want. If you have any questions, you can reach out to me or the AAFE directly, info@facialaesthetics.org. Check out afedentist.com or the different Gum Builder courses there. Thank you for being on.